I was diagnosed with cancer of the prostate. Suddenly everything's out of control. I don't know what's going to happen. What treatment was I going to be able to have? I was suddenly, overwhelmed by this wave of emotion. One of the awful things about being a patient is waiting for results.
One of the biggest challenges to pathologists at the moment is that there aren't enough of us. Not having enough people to make the diagnosis is also compounded by the fact that the reports that we're actually writing is a much more complex and nuanced report than it was sort of 5–10 years ago.
We've had the advent of digital pathology in the last few years, and that involves moving from reporting glass slides on microscopes to reporting digital slide images.
Digital pathology has allowed us to work more closely together, and several of us can review images at the same time and even remotely, but it also allows people to then consider whether or not we can use artificial intelligence to interpret those images.
Page Prostate is a powerful artificial intelligence system, and it identifies within an image of tissue areas that are suspicious for harboring cancer, and it generates an output that's a visual overlay as well as quantitative information about the potential severity of the cancer.
So as a prostate biopsy passes through our laboratory, it's read by Page Prostate, and the output is available to me as I go to report the case. Importantly, as a pathologist with years of expertise in this field, I retain oversight of the final report. Ultimately, there's still a human at the end of the chain.
In bringing a technology such as artificial intelligence to pathology and to cancer diagnosis, it's essential to build trust. Trust among pathologists who are using it, trust among patients and the public, and trust also among the institutions.
I was very privileged to be at the start of this process and felt that I was able to influence some of the thinking and the way the project was presented to patients, because gaining patients' trust is such an important issue.
We've got a lot of questions, I think, at the moment. Patients have a trust in what we do, so they would want to know that if we're going to change the way in which we make a diagnosis, that we trust that.
We don't have enough pathologists as it is, and so these technologies can hopefully take some of the workload from us.
I see AI as being useful, not just in terms of making a diagnosis, but in terms of seeing things that pathologists can't, and making better diagnostic and prognostic decisions for patient groups than we can today. It's quite exciting.
This is about creating a legacy, enabling these technologies right across the NHS and really transforming histopathology for the modern era with artificial intelligence.